Okay, guys, in this video, if you watch a video, they can go over like the SSIs, antidepressants, and the benzos. But wait a minute, I'm just like this. I'm at home. I don't need no scrubs on. I'm not taking my degrees down, but I'm in my pajamas. Okay, this.
Let's start with the most prescribed group of anxiety medication. Number 1, SSRIs, selective serotonin reuptake inhibitors, drugs like Zoloft, Lexapro, and Prozac. Your brain has a chemical called serotonin that helps you feel calm and steady. Normally, after your brain releases serotonin, it gets vacuumed back almost immediately. SSRIs block that vacuum, so serotonin floats around longer. And over a few weeks, this helps quiet the worry circuit.
It's normal. So normally it's vacuuming back. But the pills keep it on. Let's check it out. Come on, brother.
SSRIs don't kick in right away. In the first 2 weeks, you might actually feel worse, more anxious, more on edge. Some people quit before the medication even has a chance to do its job. And then there's something doctors rarely warn you about: emotional blunting. According to a large New Zealand survey, up to 60% of long-term SSRI users report it.
Wait, you said 60%? 60% emotional blunting? That's over half. Man, 60%? Oh, let's see what this emotional blunting is. This is a fair use. I'm just talking about the black box warning on these medications.
You don't feel deeply sad anymore, but you don't feel deeply happy either.
I mean, you're a zombie, right? You're not happy, you're not sad. Let's see.
Sex feels muted. Music doesn't move
Sex? No sex?
you the way it used to. You're
Music doesn't? Because music is therapy to me.
calmer, but something is missing. And then there's the side effects doctors often downplay: weight gain. Studies show that SSRIs can cause people to gain a little weight over time. When people first start
Wait a minute, you're a fat zombie?
a different type of antidepressant called Wellbutrin, bupropion, causes the least weight gain of all. Number 2, SNRIs. Now here's where it gets weirder. This second group of medications takes everything SSRIs do and adds another layer on
Basically, all the side effects.
top. Serotonin and norepinephrine reuptake inhibitors, SNRIs, include drugs like Effexor and Cymbalta. These don't just keep serotonin around longer, they also boost norepinephrine, which is your brain's energy and focus chemical. So instead of just feeling calmer, it can also help you feel sharper, more alert. For some people, this combination is a game changer. The anxiety drops, the energy returns, and life gets workable again. But here's what nobody tells you. SNRIs are notoriously difficult to come off of.
What? Ooh, wait a minute. They're very difficult to come off of. They take about 3 to 4 weeks, even 6 weeks to kick in. Once it kick in, Z Nation.
Effexor is famous for what users call brain zaps, tiny electric shock sensations in your head when you miss a dose.
This medication shock therapy? So your loved one walking around, they getting shocks in their head. They black box warning, fair use.
A 2019 study published in the Addictive Behaviors Journal reported an average antidepressant withdrawal incidence of 56%.
56%. You round it off, there's still gonna be 60%. So over half gonna have withdrawal effects.
The medication works, but your brain quietly becomes dependent on the steady supply.
Wait. How did the medication work? If you get addicted, you got brain zapping, you got emotional blunting, so you're a zombie, you gaining weight, and you're not interested in sex. Are you sure the medication is working?
Let's move on to number 3, buspirone. This is one medication almost nobody talks about. It doesn't sedate you, it doesn't get you high, it doesn't cause dependence, it just gently turns down the volume on chronic worry over a few weeks. The catch, it only works for some people.
Man, I thought we just finna have one. The problem is only for some people. So how are we gonna figure out if it works for some people? We have to get to all people first.
But for the ones it does work for, it's one of the cleanest anxiety medications available. No emotional blunting, no withdrawal, no sexual side effects, no weight gain. Number 4, hydroxyzine. The brand name is Withdrawal. Technically an antihistamine, same family as Benadryl, but at certain doses it has real calming effect on the nervous system. It works fast, within 30 minutes, no dependence, no withdrawal. Doctors often prescribe it as the non-addictive alternative for anxious nights when your brain just won't shut off. The trade-off? It can make you drowsy, really drowsy. So it's mostly used short-term or as a sleep aid when anxiety is keeping you awake at 2 a.m. Number 5.
Now I do like hydroxyzine because again, you take it at night to help you sleep. If you're itching, it's designed for itching. So that one, it's pretty good medication. I recommend that for especially young people, anybody. I recommend that the less powerful drugs first.
Beta blockers. Here's where it gets fascinating. Some of the most effective anxiety medications were never designed for anxiety at all. Beta blockers, like propranolol, were originally made for high blood pressure. Then doctors noticed something strange. Patients on beta blockers stopped having physical panic symptoms. Here's why. When you get anxious, your body releases adrenaline, your heart pounds, your heart trembles, your voice shakes. Beta blockers block adrenaline, the body's primary fight-or-flight chemical, from reaching your heart and blood vessels. This helps your body relax. Think of it like unplugging the body from the brain's alarm system. But beta blockers like propranolol also reduce the emotional intensity of stress and anxiety, not just the physical symptoms. This is why public speakers and musicians take them before performances.
Oh, okay, messed me up right there. Listen, if you're a public speaker and you're doing okay, you don't need to add a pill. If you're a performance artist, if you don't need the medication should be used as last results. So you can't say, I'm a public speaker, I'm going to use this medication. I'm a musician, I'm using medication. I just don't like people offering medication for people who don't need medication.
They calm the brain and help to break the loop where physical panic feeds mental panic. They work fast and can be taken 30 to 60 minutes before a performance or anxiety-provoking events. Number 7, Benzodiazepines. The most powerful anxiety medications ever created, and the most dangerous. Examples are Xanax, Ativan, Klonopin, and Valium. The rescue drugs, the ones people take when a panic attack is actually happening. Within 20 minutes, you can feel the effects. Picture this. You're driving on the highway and suddenly develop a panic attack. You immediately pull over, your hands are shaking, your heart is pounding so hard you can hear it. You feel like you're having a heart attack. You take a Xanax. 15 minutes later, you feel the panic easing off. You begin to feel more like yourself again. And in that moment, the pill feels like a lifesaver. But here's the part nobody warned you about. The brain adapts. After a few weeks of regular use, the brain's GABA receptors undergo down-regulation. This makes the system less responsive to GABA. Stop taking it suddenly, and your nervous system goes into a shock-like state.
He said only a few weeks. So you could get on this medication for a few weeks only. The benzos. Your life can change forever. So that's why I always say pills are pain. You got to make a decision. And when you're taking pills, sometimes you're making a lifetime decision. People need to know. Because they're going to tell you, oh, it takes a few weeks to kick in. Now he just told you, after 3 weeks, it's going to be hard to detox from it. Black box warning. I'm not a doctor, he is. I'm a nurse. This is for educational purposes only. Sometimes you gotta ask yourself, pills or pain?
According to a 2017 study published in the New England Journal of Medicine, benzodiazepines are relatively safe for short-term use. 2 to 4 weeks.
See, it doesn't make sense. He just said, look, for 2 to 4 weeks, it's supposed to be safe. But in 2 to 4 weeks, your brain can get addicted to it. So you have to detox from it. So the math not adding up. It doesn't, you know what I'm saying? The math not adding up. And by the time it does kick in, by 2 to 3 weeks or 4 weeks, now really like 4 to 6 weeks, you're already physically addicted to the medication. I mean, you're going to have a serious detox, and you might go into seizures, or you might have worse panic attacks, zombie effects. Give it to me, brother.
Long-term use is not recommended.
See, okay, I'm speechless. They tell you don't take it long term, but people are taking it for life because you get physically dependent on it.
Also, dependence develops in about half of patients who use benzodiazepines for longer than 4 weeks.
See what I'm saying? You get dependent in 4 weeks. It doesn't kick in till 4 weeks. 4 weeks can ruin your life. So you got to take pills at the last result. There's no game here. Yes, if you're extremely homicidal, suicidal, end of your rope, yeah, you got to take pills to save your life. But you got to do your own research. You got to do your own research. Sometimes the side effects are worse than the effects. That makes sense. I'm from the South, so if I have some bad grammar, it is what it is.
Just 4 weeks. This is the part most people don't often talk about. Most of these medications work. They genuinely save lives. Millions of people are functional today because of them, but they were never meant to be the whole answer.
You see, millions of people are functioning on these things.
They were meant to be a bridge, something that holds you steady while you address what's actually underneath. And what's underneath is almost never just brain chemistry.
Now this part here, I do like what he says, but I'm gonna let him say it first, then I'm gonna go over it. I'm doing a black box warning video. That's what I'm doing.
It's a nervous system stuck in fight or flight for years. Sleep that's been broken night after night. Hormones shifting in midlife. Inflammation quietly burning in the background. Chronic stress that never gets addressed. No pill fixes those things. The pill stabilizes the symptoms while the root cause keeps burning underneath. So if you're someone who's been on medication for years and still doesn't feel like yourself, you're not broken. You're not.
Okay, this is like the drug companies. They already put the side effects at the end of the video. If you put this message at the beginning of the video before the pills, then for me it'd be better, because people got to make a decision. You know, yes, they have anxieties that been happening for them for years and years. A lot of people been abused, been verbally abused. They may be chemical imbalance. They have a lot of issues, but we got to deal with the underlying issues of the issues. Got to put it on your back. So first, you need to go to therapy first. Try to deal with the issues, what's causing the pain first. But the way it's set up is we give you pills first. Then by the time you peel it on your back, you're already addicted to something else. You're chemically, physically, and addicted to medication within 4 weeks. So what I'm saying here, medication is good for everybody. Not everybody, for some people, but you should be told the side effects first, and we should also have alternatives first to go through. You should start with the weakest medicine first. If I'm dealing with the issue of my childhood trauma, I need to deal with that first. I need to go to therapy to deal with that. And I'm gonna tell you a crazy story, right? I was assessing this guy, right? And when I do my nurse's assessment, I always try to make it look like a conversation. I got to ask the questions, but I got to ask it in a conversational way, you know. So I don't go and say, "Hey, you been in a trauma?" You know, I don't attack it that way. I just have conversations like, "How's it going?" The wife and kids and stuff like that. Hey, dude, how you ever, you know, are you having any little abuse in your life? You know, physical or sexual abuse? What about some strange kind of trauma, like you feel panic attacks, like you feel you're gonna die and stuff like that. And the guy asked me, said, "Oh, you mean like the time I got shot?" And I'm like, whoa, like the time he got shot. So he got shot and he never dealt with that. You know, I've been robbed a couple of times in the hood. I never dealt with it either. So I went to the hospital to get therapy. I didn't know about therapy then. But I told my friends and family, so that was my therapy. I had a support group at home. So we got to deal with the pain, what's going on underneath first. The problem is, by the time you find out if something's wrong, it's at extreme measures. Like I said, I'm not saying don't take pills. I'm a nurse. I'm pro-pill. But I'm just saying that we have to try all the options. We need to tell the people the truth. Tell the truth. So they can choose the pain or the pills. Because it's like this. Pet Sematary was one of my favorite movies, right? And this old man on the porch, and he told this guy who was trying to bring back his loved one, and he said, sometime dead is better. Now, it sounds bad, but sometimes pain is better. If it's not an extreme case, if it's really, really extreme, then you need to be on pills. The problem is we need to find a system to get you off the pills. Because you can't say it's meant for short term only, then you're giving the people, it doesn't kick in till after that short term runs out. You're supposed to be on it like 2 or 3 weeks, 4 weeks, but the medicine don't kick in till 4 to 6 weeks. But in my black box warning, best thing I like about it, he gave some warnings in. I just wish he gave the warnings in the beginning so we could start seeing therapy, deep breathing, meditation. People have panic attacks because their body got control over them. Like I like lemon pie, right? But I can't eat lemon pie maybe once a year because I love it so much. But my body gonna crave it. It's gonna say, hey, Steve, go get the lemon pie. So I gotta learn to make my body sit still. Once I get control of my body with meditation and deep breathing, well, if I make my body stay still for like 5 minutes, then I can start making my body follow my mind, do what I wanted to do and not what it wanted to do. Because people have panic attack, they need to die, their body got control of them. So that's about it. It was a good video. Do a black box warning series because it's really sad to me that I meet people and they shaking every day, they hurting every day. And it happened to them when they did some of the teenagers, when they got put on pills when they was 14, 16, 17-year-old. Now they're 45 years old, 50 years old, and they never been off pills. I meet patients who've never been to sleep without Ambien. That's about it, guys. But this is one of my black box warning. I'm going to start taking all the medications and do videos, and I'm just highlight the side effects, not the pros and cons. Like he said a lot of good things, but he also said a little bit of side effects. But it should scare you about emotional blunting, gaining weight, emotionally not there, sexually not there, forever. This is about it, man. Deuces.